BPH is benign prostatic hyperplasia. This is hyperplasia of both the prostatic stroma as well as the glands. It's an age-related change. It's seen in most men by the age of 50. Important to note that despite the fact that we call this hyperplasia, there is no increased risk for cancer. Now, I am particular about pointing this out because, generally speaking, recall from Chapter 1 that when you have pathologic hyperplasia, that's classically a soil or a risk factor for the development of cancer. However, in the case of benign prostatic hyperplasia, there is no increased risk for cancer. Very important to note this. BPH is driven by DHT. Recall that testosterone is converted to DHT by 5-alpha reductase in the stromal cells. That DHT then acts on the androgen receptors of both the stromal and epithelial cells to result in hyperplastic nodules. It's important to note, and particularly high yield, that BPH occurs in the periurethral zone of the prostate. So that if I took the prostate on cross-section and the urethra is running through the center of it, BPH occurs here around the periurethral zone. Now that's particularly important because BPH will then result in compression of the urethra, and most of the clinical features of BPH are all due to urinary obstruction. For example, patients will have problems starting and stopping the urine stream. Patients also experience impaired bladder emptying. Again, recall that the prostate sits at the base of the bladder, and running through the prostate, of course, is the urethra. Now, BPH is occurring in the periurethral zone, which is then creating an obstruction, and this will impair bladder emptying. In addition, the bladder is going to have to press against that obstruction, and so therefore the smooth muscle of the wall of the bladder will undergo hypertrophy. It's also possible that the high pressure generated by the bladder as it pushes against the obstruction could result in diverticuli or outpouching of the bladder wall. So these are all, again, consequences of the fact that BPH occurs in the periurethral zone. Patients can also experience dribbling, hypertrophy of the bladder wall smooth muscle, as I've already stated. Microscopic hematuria may be present, and important to note that the PSA is often slightly elevated. Now, the reason why the PSA is elevated is because PSA is produced by the prostatic glands. And so if there are extra prostatic glands because there is hyperplasia, there will be an increase in PSA as well. But at the same time, it's important to note that this is only a slight elevation, so that the normal PSA ranges from 0 to 4. Generally speaking, in BPH, the PSA will range from anywhere from 4 to 10. And this is considered a slight elevation in the PSA. One of the complications of obstruction of the bladder is that you could also have subsequent buildup of fluid backing up into the kidney. And when fluid backs up into the kidney because it can't be drained, that's called hydronephrosis. Of course, hydronephrosis results in dilatation of the ureter and can also result in dilatation and atrophy of the kidney. And so this is an image of hydronephrosis. There are multiple possible treatments for BPH. One possibility would be to use alpha-1 antagonists, and this again would relax smooth muscle. Now the benefit of alpha-1 antagonists such as terazosin is not only do they relax the smooth muscle to then relieve the obstruction of the prostate, but in addition, terazosin would benefit the patient by relaxing the smooth muscle of the blood vessel wall, so that if the patients are hypertensive, you sort of kill two birds with one stone. If the patient happens to be normotensive, then a selective alpha-1A antagonist could be used, such as tamulosin, which would avoid the alpha-1B effects on the vascular smooth muscle. An additional pharmacologic treatment would be to use a 5-alpha reductase inhibitor. You'll recall that BPH is driven by DHT, and it's 5-alpha reductase that converts testosterone to DHT. Now, the unfortunate thing about 5-alpha reductase inhibitors is that they usually take months to produce results.